Now, our first speaker today is, of course, Congressman Brian Higgins. Congressman Higgins represents New York's 26th congressional district, which includes portions of Erie and Niagara counties, and is home to, here, Roswell Park. Congressman Higgins serves on the House Budget Committee and the Committee on Ways and Means, including its Subcommittee on Health. He is also co-chair of the Congressional Cancer Caucus, founder of the National Institutes of Health Caucus, and, of course, a very strong voice for cancer patients in Western New York and on.
Thanks, Rebecca, and thank you, Dr. Mary Reed, and also Candace Johnson, a great leader at Roswell Park Comprehensive Cancer Center. I just want to tell a story that Candace has heard before, but oftentimes cancer advocates select a day in Washington where they converge on the nation's capital to advocate for increased funding for cancer research through the National Institutes of Health, but also the National Cancer Institute. And oftentimes they're researchers, they're investigators, and they come to the office and I ask how Candace is doing, and they light up and they say that, I said, oh my gosh, this is quite a response. They say about Candace Johnson that she not only directs and instructs their research, she inspires it. In any institution, the real measure of leadership is the inspiration that you instill in the people that are so integral to the mission at Roswell. So Candace, thank you for your friendship. Thank you for your leadership. And today, February 4th, is recognized as World Cancer Day, a time to raise awareness and encourage action to address challenges related to cancer worldwide. We are pleased to have Roswell Park Comprehensive Cancer Center join us as we discuss new legislation aimed at increasing lung cancer screening. Roswell Park has been a national leader in cancer research and treatment, the first comprehensive cancer center in the nation, groundbreaking work in chemical therapy, chemotherapy, in critical links between tobacco use and cancer, and going on right now, one of 24 institutes where you have clinical trials occurring in the area of immunotherapy, enhancing the body's ability to fight cancer. Cancer continues to be the second leading cause of death in the United States. Many people die from lung cancer than any other type of cancer. Screening is critical to detecting cancer early and saving lives. The statistics are compelling. You often hear that less than 10% of cancer deaths are attributed to the original tumor. It's when cancer moves, it's when it advances, when it metastasizes, that it becomes lethal. Just underscoring the importance of early detection toward the goal of saving lives. According to the National Cancer Institute, between 2010 and 2015, only 6% of all adults for whom screening is recommended underwent this very, very simple procedure. So today, we are announcing legislation to help increase cancer screening rates, improving the quality of patient care received and helping to ensure that more people are lung cancer survivors. There's very impressive results, particularly in the last 5 years. Lung cancer is one of the most lethal of all cancers, yet lung cancer survival rates, that is beyond 5 years of the original diagnosis, has improved 13% in the past decade to 22.5%. That is a cancer that was once a death sentence. Now 22.5% are surviving beyond 5 years of their diagnosis. We also learn that if we eliminated tobacco use, which we know from studies that came out of Roswell, you could eliminate almost 35% of all cancer deaths. And smoking and tobacco use is 80 to 90% of lung cancer deaths. So we've made good progress, but still we have a far way to go. So the legislation provides grants to support the establishment and the operation of new lung cancer screening registries. Currently, there is only one lung cancer screening registry approved by the Centers for Medicare and Medicaid Services. Before a doctor can perform a lung cancer screening CT, the doctor's office must have access to a lung cancer screening registry. Our legislation, the Lung Cancer Screening Registry and Quality Improvement Act, HR 107, helps alleviate the bottleneck in screening access by providing $2 million in grants annually for 5 years to assist with the creation and maintenance of a free lung cancer screening registry accessible to lung CT providers nationwide, eliminating one of the most significant barriers to lung cancer screening. Additionally, the bill would provide $1 million annually for 5 years to encourage the development of quality measures using registry data to improve the quality of care and patient outcomes in the lung cancer screening space. The mortality rates related to lung cancer make this an urgent issue. COVID increases the urgency of this mission. Lung cancer patients are at a high risk of severe COVID symptoms, leading to greater rates of hospitalization and death. Now I'd like to turn it over to the experts from Roswell Park Comprehensive Cancer Center, Dr. Mary Reed and Candace Johnson. Thank you for including me.
It's really an honor to be able to share my input on the same stage with you, Congressman Higgins, and I really appreciate the leadership that you're showing in bringing this bill forward. You know, you've stated the most important information about lung cancer, that it kills more Americans, it kills more people worldwide than all the other major cancers combined. While it's attributable to smoking, the lack of early detection means that the majority of lung cancers currently are still diagnosed at late stages where cure is not an option. We know that just by lung cancer screening with a low dose CT, that we can shift that to the majority of people having the span of options for treatment, and this will dramatically increase the survivability, as was shown in large clinical trials. The U.S. Preventive Task Force has set the eligibility for lung cancer screening at age 55 with 1 pack a day for 30 years. And we know because of research ongoing with lung cancer screening, that we expect that these guidelines will be lowered to 50 years with 20 years of smoking, because that will shift and make more people eligible. But the issue that your bill addresses, this fee that is charged to providers who want to do the low dose CT, has been a major barrier, and especially impacting underserved areas, rural and indigenous areas where smoking really has a high burden. You know, we know that 40% of people who live in the areas most impacted by lung cancer mortality drive an hour or more to get to a CT center where they can be screened. And this is very significant. Opening up lung cancer screening through a free registry that will provide information to CMS means that the local radiology practice can now start to participate, and we know that that will drive up compliance. And again, nationally, we're at 6% of eligible people being screened, but we know that in rural areas that is more like a 2% eligible people being screened. So this is a very significant bill. This is a matter of access, of equity, and it has life-saving importance. Lung cancer screening, we believe, will prove to be the most effective, most impactful screening test that we currently have available. And increasing access, especially in these areas of underserved, will save tens of thousands of lives, not over 5 years, but immediately, as we are able to pick up small lung cancers where people can be cured of lung cancer, where we can start to turn lung cancer into a chronic, condition. And that has a huge impact. And I really appreciate your leadership in this area. This is really going to change the lives for so many Americans nationwide. So thank you.
Thank you.
So thanks, Mary. We're so proud. I'm bursting with pride. I've known Mary. Actually, we came to Roswell Park around the same time, and she has really dedicated her life to lung cancer and finding ways to detect it early, and devoted to this disparity issue where individuals just don't have access to this wonderful screening measure. And Congressman Higgins knows exactly how I feel about him. I'm just so grateful to have him represent us. He's an amazing man, and I think he and I have been working together for a number of years, and I think we're both doing incredible things, and I thank him so much. This really is a matter of health equity. There's no question about it. It strikes lung cancer, strikes individuals that are smoking. Poverty is a risk factor because you're maybe not getting your health care, and access to this life-saving screening measure. They just don't have access to it. And this has been a real problem because the fact of the matter is these screening measures can help save lives. Roswell Park, we're committed to do everything that we can to help identify and highlight and correct these unequal issues as it relates to healthcare access, healthcare delivery, and health outcomes. It's the core of what we do. And it's especially important right now because here we are, this is World Cancer Day. We're still in the middle of a COVID pandemic, but cancer hasn't stopped. I mean, cancer is still here, it's still with us. And we're here trying to provide the best care that we can during this pandemic. But it's really critical that we don't stop screening during this pandemic period, and especially for folks in disparate regions of our community, because cancer is still out there, and we need to continue these efforts so that we can make a difference in these people's lives. Congressman, you're an incredible friend and a champion of Roswell Park and for cancer patients. I can remember when I first started here, and you were more junior in your in Congress, but you were there. I remember seeing clips of you on the floor of the House talking about and advocating for funding for NCI. I just thought, who is this man? My goodness. Well, he's your congressman. So you've continued to be that advocate and our champion, and I thank you from the bottom of my heart for that. So I'm grateful for your friendship and your hard work. Mary, we're all going to work really hard and make this a real success. When Mary Reed puts her mind to it, good things happen. So we're really excited about this. And I turn it back over to you, Congressman, for the last word.
Just want to thank everybody. And, when you really look at this, it's a very small financial investment to get a very, very big return. And, screening is very, very important. And, my hope is that this federal money and more of it will continue to go to Roswell Park because you are viewed in the eyes of the National Institutes of Health and the National Cancer Institutes from the very, very top to be amongst the best cancer centers in the entire country, doing groundbreaking research in every area of therapy, be it chemotherapy, be it immunotherapy, be it radiation, be it surgery. Roswell is always at the cutting edge of doing critical clinical trials toward the goal of testing the efficacy of that new treatment. So we want to continue to keep Roswell at the cutting edge, and you earned that place. You went from, in a very short period of time, from number 40 in the country to now in the top 15. And I can see you surging right through to the top 10. And as you know, when you have that kind of reputation, you're able to attract all the rock star researchers that bring with them big money. So my goal is to fight aggressively for enactment of this bill. And I think we have an administration, a new administration, that recognizes at a very, very personal level the importance of cancer research and how critical these initiatives are toward the goal of increasing survivability, increasing life quality, and saving money. So with that, we can take any questions anybody may have about this initiative and generally speaking.